Welcome to our dedicated Wednesday ritual, Young Minds Summit. Young Minds Summit.
Okay.
Recently, we had an academic extravaganza in Cochin during our ANSIPs. Now we extend it to our state with the exclusive ganja-related psychological issues and management. We have a young, intelligent and cool psychiatrist, Dr. Subash, the son of our CME committee chairperson, Dr. Raman Rao Garu, to deliver the goods. We invite Dr. Himakar Garu to chair the session and Dr. Raman Rao Garu to preside over the proceedings. Dr. Kishore Kumar will, our treasurer, will moderate the proceedings and extend vote of thanks in the end of the session. Thank you very much. Raman Rao Garu, take over, please. Okay.
Should I start? Hello. Thank you.
Sir.
I
Sir,
will.
no, sir. Geo sir.
Raman Rao sir, to give an introduction. He is not there, huh?
He's not there, sir, actually.
Sir, Geo sir, sir, so, sir, we invite Dr. Geo Ramarao Garu, CME Committee Chairman of IPS AP State Branch, to give a brief message and introduce the chairperson.
Okay.
He has to unmute, sir.
Raman Rao Garu.
Sir, am I audible, sir?
Raman Rao Garu,
yes, sir. Yes, sir.
Now you are audible, sir. Yeah,
sir. Okay, sir. Dr. Himakar is my close friend and he is my almost contemporary. 1 year senior in Andhra Medical College. When I was doing my MBBS in RMC, he was doing his MBBS in AMC, and he has done his DPM and MD both at CIP Ranchi. And then he has joined as assistant professor in Andhra Medical College. Later, one second. This is, I think, I'll close one.
yes. It's fine, sir. Chapandi.
Later, he had joined as assistant professor in Andhra Medical College and promoted as professor of psychiatry. And he was the HOD for quite a long time. Later, he was promoted as the superintendent of the hospital, Vizag Mental Hospital. And then he was promoted as superintendent of the Vizianagaram General Hospital and also deputy DME, Government of Andhra Pradesh. And his interests are mainly related to the drug addiction. Especially, he is an expert in the field of cannabis abuse disorders. So, with this brief introduction, I'll ask Dr. Himakar Garu to go ahead with his, chairman's remarks. Thank you very much.
Thank you, Raman Rao Garu. Thank you, the organizing committee of the IPS Psychiatry, the Andhra branch. Today's the topic is on cannabis and related issues. Our Dr. Subash will talk on that, and briefly I give the introduction about Dr. G. Subash. He did his MBBS from GSL Medical College and MD from Narayana Medical College, and currently he is working along with his father Raman Rao in Shanthi Hospitals, Bhimavaram. we all know him. His introduction is very formality. And nowadays that cannabis is such an important thing that sorry to say that Vizag has become a important nidus to all this export of this cannabis from our agency area. Agency area means this Aruku and all these things. Usually these drugs are more where these antisocial activities are there, but Naxalites or all anywhere drug this thing is usage is more wherever there is this antisocial terrorist activities are there, particularly in our borders, particularly for Punjab border, Madras, the LTTE time and Mizoram, all of that, heroin was very popular. In our this thing, the Naxalites are very this thing. They support the tribal people to cultivate cannabis, and then from here to smuggle all over the area. Now it is becoming more popular. Of course, cannabis has a lot of controversies in that. Some people say that it is not a dangerous drug. In some countries it is legalized. But it is proved beyond doubt that it is a dangerous drug. It can cause the serious psychiatric illnesses. And for that, genetic basis also was noticed. So we must be very careful. Though its addiction potential is not as high as heroin or as high as morphine, but it has a problem giving. Sorry. It can give problems. So I think we'll refresh our knowledge today after listening to the Dr. Subash, and I request Dr. Subash to start his speech on cannabis and its related issues. Please, Dr. Subash, please start.
Thank you, sir, for your warm introduction. Am I audible, sir?
Yes.
Yes.
Okay. So I would like to thank the CME committee for giving me this wonderful opportunity to interact with you. Today I'll be talking about the socio-cultural, legal and clinical aspects of cannabis.
Yes.
So I'm sharing my screen. One second. My scheme of presentation would be introduction, cannabis preparations, methods of use, Indian epidemiology, the legal implications, pharmacology, clinical features, side effects, screening, therapeutic effects, and conclusion. So as we all know, cannabis is the fourth most commonly used psychoactive drug in the world after caffeine, alcohol, and nicotine. Cannabis preparations are most commonly obtained from the plant Cannabis sativa, and it was used in India, China, and Middle East since many centuries for its fiber and medicinal properties. And its use became popular, especially in the Western countries, in the youth in the 70s and 80s through movies, music, art, and culture. The term, one second. Hello.
Yes.
Okay. The term cannabis refers to both the plant and its psychoactive preparations. Cannabinoids are the compounds which are obtained from the cannabis plant that have psychoactive properties. Synthetic cannabinoids are the compounds which are synthesized in the labs with similar properties of natural cannabinoids, but they are more potent. Coming to the cannabis preparations, cannabis plant, it occurs both in male and female forms, and the female plant has highest concentrations of delta-9 tetrahydrocannabinol. Delta 9 THC is the cannabinoid that is responsible for the psychoactive effects of cannabis. Flowering tops, they have the highest concentrations of tetrahydrocannabinol. So as you can see, on the left side, it is the female flower, and on the right side, we have the male cannabis flower. And the most common cannabis preparations are bhang, which is extracted from the dried leaves, and it has the lowest concentrations of THC, 0.5 to 3%, followed by ganja or marijuana, which is extracted from the flowering tops, which has around 3 to 5% THC. And charas, hashish or hash oil is extracted from the resin, which has 5 to 8% tetrahydrocannabinol. Coming to the methods of use of cannabis, smoking cannabis through cigarettes or joints is the most common method of use, and followed by the water pipe or bong. Heavy cannabis users usually use this bong, which you can see on the right side, where the cannabis is burnt at the stem and the smoke is inhaled through the mouthpiece. And on the left side, you can see the hash cakes. Those who have visited Amsterdam might have encountered these kinds of cakes and shops where the cannabis products are commonly sold. They are sold in various forms like pastries, donuts, chocolates, toffees, etc. And in our country, cannabis is, especially the bhang, is eaten or drunk for the holy festivals like Shivratri and Holi. And it is prepared in this manner. And on the right side bottom, you can see the vaporizer, wherein the cannabis is heated, it's not burnt, and the vapors are inhaled. The main difference between the bong and the vaporizer is the vaporizer has the benefit of reducing the risk of damage to the respiratory epithelium, as it is smoke free, and reduces the risk of cough, sputum, and other chronic disorders like allergic bronchitis and bronchogenic carcinomas. Coming to the epidemiology, in any culture, cannabis use is more common in the teens or young adult males. In 2019, the Ministry of Social Justice and Empowerment revealed the stats associated with the psychoactive substance use through a nationwide survey and respondent-driven sampling. And according to this survey, around 3.1 crore users, that is around 2.8% of the population, are cannabis users, and 72 lakh are problem users, and 25 lakhs are dependent users. And in the problem users, the charas or ganja using people are more of the problem users than those who are using the bhang. Coming to the prevalence, according to the population groups, around 5% of the males are using cannabis, and the prevalence rates in children is around 0.9%. Overall, in adults above 18 years, the prevalence is around 3.3%. Coming to the prevalence of the current use and problem use in India, if you observe this bar diagram, the proportion of problem use is more in the group of people who use ganja or charas when compared to the people who use bhang, which can be explained by the higher concentrations of tetrahydrocannabinol in ganja or charas. Coming to the prevalence of current use of charas or ganja in the state in the statewide distribution. The maximum usage is seen in the northeastern states and northern India. Sikkim being at the top, followed by Nagaland and Orissa. The southern states are the least users among the total country. And the top 10 states which are using cannabis are, first comes Uttar Pradesh, which can be explained by the high density of population in that state. Coming to the legal implications, bhang is legally available in many states, but ganja and charas, they are illegal according to the International Drug Conventions and the NDPS Act. Cultivation of industrial and medical cannabis is legalized in Uttarakhand, and controlled cultivation is allowed in some districts of Gujarat, Madhya Pradesh, Uttar Pradesh. Medical cannabis is permissible under law through a license. Cultivation without a license can lead to an imprisonment for up to 10 years and a fine up to 10 lakhs. Possession, sale or purchase in small quantities. Small quantities means less than 1 kg ganja can lead to imprisonment of 6 months or fine up to 10,000. CBD oil, which is manufactured under the Drug and Cosmetic Act, can be legally obtained and used. Legal hemp must not contain no more than 0.3% THC. Coming to the global perspective, legality for medical and recreational use, it varies from country to country in terms of its possession, cultivation, the medical indications, and the manner in which it is consumed. And these policies are regulated by, These policies are regulated by 3 UN treaties. And recently, the removal of cannabis from Schedule 4 to Schedule 1 is a change in the laws in 2021. Schedule 4 means low potential for abuse and dependence. Schedule 1 means most potential for abuse and dependence. So this particular figure depicts the legal status of cannabis for recreational use. As you can see, most of the North American states, it has been legalized for recreational use, and scattered countries in other continents. In India, it is the use of cannabis is illegal, but often it is unenforced. So this particular diagram again depicts the legal status for medical use. This is a older one. I couldn't get the recent one because India should also be in green color, as the drug recently, cannabidiol has been approved for epilepsy. Coming to the pharmacology, cannabis acts on the CB1 and CB2 receptors of the endocannabinoid system. The CB1 receptors, they are located in the brain, and they are abundant in the hippocampus. And these receptors, they mediate the psychological and behavioral effects of cannabis. CB2 receptors are located in the immune system. The CB1 receptors, they trigger the dopamine release from the mesolimbic reward system. They are the G protein coupled receptors, and they can be stimulated by the endocannabinoids anandamide and 2-arachnidyl glycerol, and which are the retrograde neurotransmitters. Rimonabant is a CB1 antagonist. It was a drug which was approved earlier in Europe in 2006 for treating obesity, but was withdrawn in 2008 due to the side effects like increased risk of depression and suicidal thoughts. A brief note on the endocannabinoid system. This endocannabinoid system primarily influences the synaptic communication and affects the biological functions like eating, learning and memory, reproduction, metabolism, growth and development. The pharmacokinetics of cannabis, it depends upon the route of administration. When smoked, The tetrahydrocannabinol is absorbed from the lungs into the bloodstream very rapidly within a minute, and peak levels are reached within 10 minutes of smoking. When swallowed, it takes around 1 to 3 hours to enter into the bloodstream, delaying the onset of the psychoactive effects. Coming to the clinical features of cannabis intoxication, the clinical features can vary from person to person. It depends upon the dose, the quantity of cannabis, the route of administration, the environment in which the person administers, and the personality profile of the individual. But the common clinical features are euphoria, intensification of the ordinary sensory experiences, increased hunger. Usually the patient attendants tell that he keeps on eating and he sleeps excessively, and the motor coordination is severely impaired, making the individual vulnerable for falls and road traffic accidents. Loss of temporal awareness. They usually confuse the past with the present. And the short-term memory is impaired, which can be explained by the abundance of the cannabinoid receptors in the hippocampus, slowing of thought process, feelings of achieving special insights, and acute psychotic symptoms in a few cases. Effects of intoxication can persist for around 3 to 4 hours when smoked, as I have already said, but can be long when consumed orally. Coming to the withdrawal symptoms, cannabis, the half-life of cannabis is relatively long. So the withdrawal symptoms are less intense when compared to alcohol or opiates, and they are non-specific. They are not very specific like that of withdrawal of alcohol or opiate. And these symptoms can be aggression, anxiety, insomnia, reduced appetite, restlessness, low mood. Cannabis and coming to cannabis and its association with psychosis. There are 3 variants in this. The first one is psychotic symptoms in cannabis intoxication. The second one is cannabis-induced psychosis. And the third one is cannabis and independent psychosis. Coming to the psychotic symptoms in cannabis intoxication, they can last for around 3 to 4 hours, but they can extend till 24 hours. And they're predominantly characterized by paranoid delusions. And the complete resolution of symptoms is noted. 30 to 50% of users experience these psychotic symptoms during intoxication. Cannabis-induced psychosis, the onset can be during intoxication or withdrawal, and it resolves within 1 month of abstinence. So the difference between these two entities is the time frame of the psychotic symptoms. In the first one, the symptoms usually resolve within few hours or even or just a day, but here it takes much longer time, and they are associated with hallucinations and delusions. Formal thought disorder is less common. Coming to the third entity, the cannabis and independent psychosis, almost around half of the patients who experience a initial episode of cannabis-induced psychosis, they are diagnosed with schizophrenia in 2 to 4 years. And the schizophrenia onset is also almost a decade earlier in those who smoke cannabis regularly compared to non-users. And the risk factors for conversion of this cannabis-induced psychosis to schizophrenia include the family history of schizophrenia, past history, early onset, age of onset, and using high potency cannabis. Coming to the lab examination, cannabinoids, they can be detected in hair, urine, sweat, saliva, and blood. Testing is most often performed using the urine samples. The urine test is based on the detection of carboxy tetrahydrocannabinol. The range is around 20 to 50 nanogram per ml, and it can be detected up to 30 days. And cannabis can be detected in blood from 1 to 7 days, but it is less frequently used as the procedure is invasive. Coming to the treatment of the withdrawal symptoms, treatment mainly focuses on alleviating the symptoms of withdrawal as in any psychoactive substance. Benzodiazepines for few days can help reduce the acute anxiety. Antipsychotics and mood stabilizers can be considered in patients with cannabis-induced psychosis with aggression. And the choice of drugs depend on the patient characteristics like age, sex, severity of the symptoms, medical and psychiatric comorbidities. Long-term treatment, psychosocial interventions are the main approach. Motivational enhancement therapy is most frequently used. It's a brief therapy taking around 1 to 4 sessions. First, the level of motivation of the patient needs to be assessed. As we all know, there are 4 levels of motivation: pre-contemplation, contemplation, determination, and action. We need to we need to focus on enhancing the patient's motivation from pre-contemplation to determination and a commitment to change. And the counseling skills like empathy, reflective listening, positive affirmations, they play a lot of role because a lot of psychodynamics are involved in these patients. Periodic urine screening needs to be done, as I have discussed it previously. Coming to the pharmacological treatment for relapse prevention, currently there are no approved medication. Naltrexone 50 mg per day is the medication which I regularly use for my patients. The other medications are N-acetylcysteine 1200 to 2400 mg per day, buspirone and baclofen 60 mg per day. I'll be presenting a couple of cases. The first one is a clinical case and the second one is a community case unit. This particular patient happened to be admitted in our hospital a few days back. He's a 25-year-old male admitted with complaint of agitation, aggression, suspicion on mother and sister that they were having affairs, restricted 4 to 5 days after stopping the cannabis use. He was extremely violent for 48 hours, attacked the family and the hospital staff, and he was started with high dose of psychotropic medication, injectables and IV fluids, and was stabilized. It is his 5th admission in our hospital. Last admission was around 1.5 years back. He has been abusing cannabis since 2018. Clinical picture is almost similar in the previous admissions. Behavioral symptoms usually persist for about 1 month. So this is a classic case of cannabis-induced psychosis. As you can see, the symptoms gradually wane off after a period of 1 month. Compliance is poor. The patient stops medication after 2 to 3 months, saying that he's all right, and he refuses to come up. And the cycle is repeating since the last few years. Coming to the community case unit, this particular case you might, some of you might have seen in the print media. This happened a few days back in a village near Hyderabad, in a high school. The students started behaving strangely. They were sleeping on the benches during the classes, were urinating in the classrooms, and they were behaving disinhibited with the girls. The headmaster, he became suspicious, and he started behaving friendly with the students and observed that they were all eating similar chocolates. And he tasted one of the chocolates and recognized it had ganja. And the police investigation revealed that 3 people from Orissa who were working in the village were the culprits. To the surprise, there were many shops which were selling these chocolates in that village. And one shop was just adjacent to the police station. And not just the students, but other people in the village, especially the daily laborers and many other males have been eating these chocolates. Coming to the other adverse effects of cannabis, it impairs psychomotor coordination and driving, and it increases the heart rate, increases the blood pressure, and can precipitate myocardial infarction in people with underlying heart disease. And it can cause chronic bronchitis, and there is increased risk of lung cancer, especially in individuals who smoke cannabis, which I have discussed previously. And it impairs the cell-mediated and humoral immunity, making the individuals vulnerable for infections. If pregnant women use cannabis, it can lead to premature labor and low birth weight. And there is an increased risk of testicular cancer, as cannabinoid receptors, they are found in the male reproductive system. Coming to the therapeutic effects, cannabidiol, the trade name Epidiolex, was approved by the US FDA in 2018 for treating the intractable seizures in Lennox-Gastaut, Dravet syndrome, and tuberous sclerosis in children 2 years and old. It is an oral solution, and the dose is around 10 to 25 mg per kg. But the cost is very high. It costs around 30,000 rupees per bottle. And the most common side effects are rise in liver enzymes, sleepiness, reduced appetite, vomiting, fever, etc. Nabilone is another synthetic analog of tetrahydrocannabinol, which was approved for treating nausea and vomiting associated with cancer chemotherapy. However, its use has been reduced with the advent of other drugs like ondansetron. Dronabinol, which is another synthetic analog, is approved in wasting syndrome and appetite stimulation in patients with HIV/AIDS. Short-term cannabinoid usage improves spasticity symptoms in multiple sclerosis. And it's also useful in patients with chronic intractable pain. Cannabidiol is marketed in many consumer products like foods, oils, lotion, capsules, cosmetics. If you search the Google, if you type CBD in the Google, you'll have thousands of pages and photos like this, claiming that cannabidiol is useful for almost each and every organ in the body from the head to toe, but none of it has any evidence base. A note on the synthetic cannabinoid receptor agonists. These they are artificially synthesized in the lab, and they act as an agonist at the CB1 receptor, and they are highly potent and they are long lasting in comparison to THC, which is a partial agonist. And the risk of serious side effects is more with these drugs, like myocardial infarctions, cerebrovascular accidents, seizures, deliriums. And they are dissolved in alcohol, sprayed on the plant material, and smoked. The most common street names are Spice and K2. They are frequently sold in the internet. The main headache with these drugs is they escape regular urine test screens, posing a problem for clinicians. Coming to the research studies on cannabis, most of the Indian research on cannabis is on prevalence studies. There is a need for qualitative research to explore the influences of the cultural norms on the rapidly growing rates of cannabis use initiation among Indians, especially in the urban population. Legislative and regulatory interventions should encourage research to prove or disprove the safety of hemp-derived products, because already we are seeing thousands of these hemp-derived products in Amazon and Flipkart, but we don't know what are the deleterious effects they are going to cause on the body of the people who use it. So I'd like to conclude that it's a complex, cannabis is a complex chemical with a wide range of effects both therapeutic and harmful. Children and children and adolescents are at the highest risk group. Community awareness programs to sensitize the public regarding the gravity of the problem is the need of the hour. Constant revision of the law is essential owing to the diversity of the drug. Thank you for giving me this opportunity.
Dr. Subash, you have presented very well. You have covered almost most of the areas. Still, though it is accepted in some of the medical conditions, because of its cost and other things, it is not very popular.
Yes, sir.
But we are worried about the school, college people and these people only. It is more commonly now seen in Vizag, this area, because this is an important transit area for this thing.
Yes, sir.
So that is the main thing. And another thing is that there is no specific antidote or specific drug to cannabis. Only
Yes,
systematic kind of treatment only will treat. And mostly supportive and psychological advice or counseling and guidance and those things only will help them, this thing. And as you say, the distinction which you say, cannabis-induced psychosis or schizophrenia precipitated by cannabis usage, these things are, we can very happily, we can treat and we can handle them.
Yes, sir. Yes.
Cannabis usage and other things, those people will come and we have to educate them, we have to treat them. And our treatment options are much less in that area. Mostly psychosocial aspects, police, the drug control, those things should come into the place. And now I think the topic is open for discussion. I'll invite comments, doubts, anything can.
రమేష్ బాబు సార్, ఎస్ ఒక్క నిమిషం రమేష్ బాబు సార్ చేస్తున్నారు సార్, ఒక్క నిమిషం రమేష్ బాబు సార్ నేను చేస్తాను.
ఓకే సార్.
రమేష్ బాబు సార్, రమేష్ బాబు సార్ ని ప్యానలిస్ట్ చేస్తారా? సార్ క్వశ్చన్ రేజ్ చేశారు. యా, సార్ రమేష్ బాబు సార్ మాట్లాడండి సార్. Your raised your hand.
Dr. Bharti is also raising her hand.
Sir,
I'm audible.
Ramesh Babu sir.
Hello.
Yes sir, you are audible sir.
I would like to present. Subash, he gave elaborate picture of this cannabis dependency, intoxication, legal aspects, everything he has given. Just I would like to add some points. In the management of cannabis intoxication, I heard some propanol is also helpful. Propanol, 40 to 60 mg per day, it is also helpful, I think.
Okay, sir.
And
okay.
in the management of cannabis withdrawal state, some drugs, dronabinol, and this also baclofen. Baclofen is also, I think they are helpful in the management of withdrawal state.
Yes sir.
In alcohol dependency, that thing, buspirone, it is, I think, we can take the help of buspirone in the case of cannabis dependency.
Okay, sir.
Later on, coming to legalization of this cannabis, I think India, those carrying small amounts of cannabis, less than 1 kg, I think they are exempted, they are decriminalized, small amounts. More than 1 kg, I think they are punishable for up to 1 year imprisonment and some 1 lakh fine. I think these are some of my inputs
Okay, sir. Okay. Okay, sir.
Congrats, Vishal.
Yeah.
Congrats,
Thank you, sir.
thanks, Subash. Okay,
Yeah.
thank you.
Okay.
Dr. Bhartikar has raised her hand.
Good job, Subash.
Thank you, madam.
Nice listening to
Thank
you.
you. Yeah.
So, extremely useful topic, Subash, because especially, they were talking about Vizag and, Hyderabad and other places. I'm telling you, you and we know, like, how it is rampant even in rural areas.
Bhartikar,
Like,
little louder.
Palakul.
Yeah.
Yeah, even if it's in rural areas like Palakul and other places also, it's quite rampant.
Yes, madam. Yeah. Yes.
The other thing I want to tell you is, whatever may be the, benefits of cannabis, I do recommend, a complete ban on those products because they tend to be misused like any other drug, especially in a country like ours, where, there is no difficult, stringent guidelines for it. And especially school children also can be, lured by such things. And again, 30 years ago, when we were in Nimans and other places, it used to be fashionable, even amongst doctors and other people, using it. And nowadays, the singers and the actors, rumors, I don't know whether it's true or not, but they are, given more chances if they are, they fall into the group and they are part of the group which take cannabis. So I think, it is a drug, it's an illicit drug. Let it be an illicit drug, whatever may be the benefits, because anyway it's going to cost more. Why can't we ban it? And as you said, there are some withdrawal symptoms for which, there are nice treatments available. In fact, you also mentioned, like Dr. Ramesh Garut said, you also mentioned something like, the baclofen and other
Yes.
things.
Yes, ma'am. Yes.
You already mentioned it.
Yes, ma'am.
Okay. Good job, Subash.
Yeah. Thank you, ma'am.
Actually, can I say one more point? Can I say?
Yes, sir. Yes, sir.
Hello?
Yeah. Yes, sir.
Actually, nowadays this cannabis availability is very, very common in all areas. In our Kurnool city also, it is very easily available. All the
Okay.
youngsters, adolescents, they are becoming prey for this cannabis. So government should strictly ban this. And recently, I heard in newspapers and TV channel also. In some near schools, some shops, they are selling this chocolates mixed with the cannabis.
Yes, sir.
Illegally, they are selling.
Yes.
So students are becoming depending on knowingly or unknowingly to this cannabis. So, we should strictly ban this, and we should conduct this awareness program among schools also.
Yes, sir.
They should not take anything cheap chocolates in the near the schools, all those things.
Yes,
Just
sir.
I wanted to
cheap.
say this.
They're not cheap.
Okay. Thank you, sir. Thank you.
Yeah. Thank you, sir.
Regarding my observations about cannabis, it's a very tricky drug and it's very commonly used. Nowadays, it is available in nook and corner of, I think, everywhere in India, especially in our areas. As Dr. Bharti was telling, there are several cases that have come up in Palkol. People were arrested who are supposed to be the vendors. So it's a big problem. And in fact, I was told by one of our patients that it was sold in local, pawn shops,
Yes.
packets. And they were usually brought to us with severe psychosis or violent behavior. Usually, it will take a lot of time for them to settle down. And it recurs also. As the case presented by Dr. Subash, he is one of our inpatients before I left to Kochi. I don't know, he would have gone against medical advice. He's very violent. In fact, people could not really control him. As we have read in our forensic medicine textbooks, run amok is one of the conditions which was usually associated with cannabis abuse. even from the time immemorial. People used to commit some violent crimes and all that under the intoxication with cannabis. So this is a very grand old, traditional, stimulant available in our own country. And tetrahydrocannabinol, which was in the highest concentrations in the Indian hemp, unlike the marijuana, which is available in the Western countries. So in our country, we see more, cases of cannabis psychosis. In fact, I remember when I was a postgraduate student, when what Dr. Himakar was describing, a Vizag mental hospital, we used to get lots of patients with cannabis psychosis, especially from the neighboring districts of Orissa, the one district by name Ganjam, I believe. We used to get lots of cases. I have done a case study also, which I'm supposed to present in Nellore Psychiatric Conference. But somehow at that time there is a flood and I could not go there and present it. But it was published in our Andhra Pradesh Journal of Psychological Medicine, if I understand, long ago. So these cannabis psychosis is usually a pleomorphic picture. You don't call it some simply like schizophrenic psychosis, or it simply call it as a bipolar disorder. It won't fit into any one of these, but it will have a pleomorphic picture. Affective component will be there. Sometimes delusions, hallucinations, florid psychosis will be there. But the complaints for treatment is very less, and they are really problematic cases in our day-to-day practice. And coming to the legality wise, most of the addiction psychiatrists, they always talk about decriminalization, which they claim that the real misuse or abuse of the cannabis will be reduced if the decriminalization is and also if it is legalized in our country. Usually the abuse potential will be reduced. That's what these our addiction psychiatrists and other sociologists they advocate. But unfortunately, it was growing. The menace is growing day in and day out, and we can't really know whether it is good for legalization or not. But it's a really debatable topic. Every time we talk about cannabis, this is the same issue that arises in most of the forums. I think that's the reason why we thought that cannabis is a very interesting topic and useful topic for most of the psychiatrist practitioners as well as for postgraduates also. So this is my observations. Thank you, Subash. You have done very well.
Yeah, thank you.
Lucid presentation. Well done.
Yeah, thank you.
It's all the question of money, in the tribal areas, all that hilly place, it is not suitable for our regular cultivation. They are encouraged by these Naxalites to cultivate this thing and pay them reasonably hefty money. That is how it is very difficult to control. They come forward and they control. In spite of our excise department, they are burning it out, confiscating and everything. Still, they continue to cultivate it. And they release the thing and they have devised such a means, you will be surprised to know how they will be smuggled to this thing. From the tribal agency area to this Visakhapatnam, from Visakhapatnam to the Hyderabad and all other places in Andhra. And through trains, buses, regular travelers, carry bags they bring and they'll export this kind of this thing menace. And about our Ramesh was mentioning, small quantity this thing. There the legal provision is the person must be identified as a known drug addict. And if a known drug addict he has something for some drug on his person for personal consumption, that will be exempted. But if anybody carrying the is in a small quantity, he cannot get exemption. That is a small hitch is there. No?
Okay.
To sensitize our people, I'm telling.
Starting is in just 2 to 3 years ago, the Himachal Pradesh government they made it legalized.
What I'm saying is the small quantity. If you take the NDPS
I understood your point. I understood your point. Sir. Yes.
First he must be established a known drug user.
Yes. And
Our people are reluctant to admit that thing. No, that is the
yes.
problem.
But when the risk comes, usually they show our prescriptions. When we usually write that he is a cannabis
To
abuser.
get exemption, by the time we got established, but usually these people are caught somewhere now, somewhere on the platform and somewhere somewhere.
Sir,
that's the thing.
sir, I have a doubt, sir. I have one doubt. I'm
Yeah.
Dr. Kishore, sir.
Yes,
Okay.
Sir, just I want to ask you, what are the precautions we have to take for a patient who has admitted in our hospital with cannabis in his pockets? We have collected some cannabis from his pockets and have kept in our desk. So, are there going to be any legal implications for any legal complications for a doctor?
No, you collect and destroy it. You don't keep all the collected samples. See, another thing is, for our the psychiatric purpose, for any time you admit a patient, you have to make a thorough search of the individual, and you should not find sorry, 1 minute. Actually, what happens is sometimes people hide things in the behind the collar and in the sleeves. So they hide in such a sometimes you cannot imagine how this is also possible like that. That kind of shock you will get when you see. So that is why whenever you admit the patient, you thoroughly search, even the dress, everything, and then you collect whatever is this thing is there and destroy it. And we don't keep any this thing and preserve it to invite problems to us. We never claim any the relief also. It is from which patient we call document that on his person so much so is recovered and he destroyed. Don't keep anything for this thing.
Can we destroy on our own, sir? For example, shall we inform anyone?
You just throw it. How much it will see? Are you going to destroy in cages in this thing? In an individual on person, at the most you find 20 grams, 25 grams, like that you'll find. That is in some potlala, something like that, some jobs in the pockets it is available, that you just destroy. That's the thing. The small quantity this has come just for to distinguish between the transporters, drug peddlers and all those things are there. So to distinguish them, it is that thing has come. It is not for our doctor this thing.
Kishore garu, there are questions in the question and answer box. Will you proceed with the questions or shall I do it on your behalf?
Actually, I'm in driving, sir. Can you please do it, sir? And then 10 minutes
That's what I observed. What is the role of psychiatrist in the primary prevention of using illicit drugs? Primary prevention for of using illicit drugs.
Yes.
I think the community awareness programs they play a main role. As a psychiatrist, we should sensitize the public through the various modes, social media, TV, print media, and also sensitizing the police, judicial authorities. So these factors, I feel personally, they make an impact on the society in the long run.
Okay, second question is from Dr. Sharath, our secretary. Wonderful presentation, Subash. Any role of therapeutic low dose of cannabidiol in the treatment of anxiety and the sleep?
No.
As far as I know, currently, I don't think there is any evidence for that.
And another question from Dr. Sharath. Any role for the RTMS in cannabis dependence treatment? As RTMS is FDA approved for nicotine dependence. Please enlighten.
Currently, there is no evidence for that particular treatment for cannabis dependence.
Yeah, so far I think these are the only questions that are there. I think our Lokesh Reddy is trying to comment something. Please go ahead.
Sir, I just wanted to ask a small question. Actually, what are the implications of legalization of cannabis in countries where it has been? Are there, I mean, the findings negative or the positive? Any information on this?
uh,
These kind of arrests will not be there. Like nowadays, what happens? Suppose the police, whenever somebody is having some cannabis in his possession, he'll be just taken to a task immediately.
Not in India, sir. Not in India, sir. Where in countries like US and Canada, where it has been legalized.
I think the societal perspective, it plays an important role, sir, because the Western society, especially the United States, is an individualistic society, and there it is mainly a rights-based society, and that is the main. I feel that is the main reason for all these legalizations, fighting for their rights. That I feel it is the reason.
No, what Dr. Lokeshwar is asking is, what are the fallouts or what are the implications of legalization in those countries? Does it really decrease the abuse potential of the society in general? That's what you are asking, isn't it? Dr.
Yes, sir.
Lokesh?
Yes, sir. After legalization, does
Yeah.
have any negative
And that's
effects?
what our colleagues, they say that definitely it is useful. In fact, legalization will help reduction of this, abuse potential.
And another thing is, as we understand, for all these drugs, like for example, heroin addicts and all those things, the people get involved in antisocial activities like stealing, cheating people, and all those things. Suppose if a drug is legalized, they need not do so much hair of area. Otherwise, they have to do all sorts of things. That is one reason. Psychosocial problem, particularly criminal problems, will be minimized. And moreover, another thing is that drug addiction, we cannot view it as a solitary kind of thing. It is a overall problem. It is usage of the drug, and it is associated psychosocial problems, family problems, all the problems put together, will be presented to us. That is the thing. So those problems will be minimized. For example, as far as I can think, you take methadone maintenance or buprenorphine maintenance for the heroin, these things. There, what is the treatment goal? They need not resort to all sorts of the illegal and unsocial methods, or theft and all those things, or cheating and all those things. They get an official drug in a proper this thing, and actually our plan is also to give the drug till they are stabilized, till the problems are solved. Then we'll negotiate with them, and then we do attempt to detox and wean him off this thing. So the main thing is that the associated social legal problems will be solved. That's the main thing.
So then, from psychiatrist's perspective, can we support legalization of cannabis?
Yes, we can say. We can say.
In fact,
but actually, what legalizing the problem comes is, if it is illegal, see what happens is, in our India itself, there is some social sanction for the usage of cannabis. You remember in our childhood, people used to do Trinadaratham, you may be remembering.
Yeah.
That they offer ganja as a prasad to Lord Shiva. Those days all we used to see. But once it legalized and give authorities to market it, then problem will be there. But as such, you take right now what they have done, medically usage, the drug, they kept it very costly, and they indicated, they given indications and those things. If that kind of restricted and controlled this thing is there, it's okay. No, they're not, because when they say that it is an advantage having some controlled studies says that it is useful in epilepsy and all those things, we have to accept the developments, no?
But medicalization may be different, and legalization for recreational use may be different.
Yeah, definitely this thing. And unless you legalize means there must be proper restrictions also.
Yeah.
For example, yes, Subash was mentioned, no? Like the 0.3% tetrahydrocannabinol and 5% tetrahydrocannabinol in preparations. You take hashish and these things, and you take regular grass, regular cannabis, ganja, the lot of difference. Where is 0.3, where is 5 grams? This thing, lot of this thing is there. No? So highly concentrated things should not be allowed. The proper legalized, there must be a proper structure will evolve so that it can be systematically used to the advantage of the community. That is the thing.
Sir,
But there are so many other medications
one
available
second.
for epilepsy. There are so many other medications are available for epilepsy and
When
other
all the
things.
fail,
So in the
intractable epilepsy only. Intractable, because there really the problematic cases will be there now. Sometimes whatever you do, things will not be controlled. In that kind of cases, as a last resort to use, everything is fair, is it not?
I think there is one more question, sir. Last question I think we can take from Dr. N.G. Nihal. Any drug effective in reducing the craving of cannabis in your clinical experience?
I have used only naltrexone, and the results are mixed.
We cannot give a definite answer for this.
Yeah.
Because as such, I appreciate you telling that in this cannabis kind of problems, craving is the main problem.
Yes,
it
sir.
is not like withdrawal symptoms or anything, those things are a problem here. Craving is the main problem. That fellow craves for that. It is difficult to handle that. There's no specific this thing. I think things will come in future. We'll see.
I think we can try with a Bisperon. Bisperon helpful for
We can
cannabis
try
dependency.
anything. We can try anything.
Yes,
Bisperon, we
yes,
can try anything. That trying is different, no? But having some evidence and some recommendations from a known body is always different. Is it not? See, we can see when we are in the clinic, we are helpless. Sometimes we have to handle the situation. We have to handle the relative, we have the patient, and send them do something. But the scientific setup in you cannot say no unless it is come through a proper controlled trials and it comes with textbooks and journals and it won't come.
And there are some case reports are there.
We cannot do no.
There are some case reports with the efficacy
Case
of
reports can be there. Case reports, anecdotal reports, personal experience reports, all those things can be. But to teach having this thing, you should have in black and white.
Yes, yes.
Regarding Dr. Lokesh question, do our psychiatrists should recommend legalization? In fact, the Addiction Psychiatrist Society of India, they recommend legalization. Since long time, they're fighting for it.
Some law comes means there must be some problem with restrictions and all those things they can write, they can define. No, you release with the 0.5% of these things only. And the legalization does not mean to leave it fully. It has power to control it also. No, that's the thing. Okay. Then if the discussion is okay, I congratulate Subash. You have done a good job. And I thank the organizing team to give us this opportunity today to chair the session. Thank you.
For this topic, I thank the CME Committee Chairman G.V. Ramanav Garu for selecting this topic and being very active for the past few taking very nice initiation in selecting the speakers and the topics. Thank you so much, sir. We thank all the CME committee members. We thank Avial Narasimha sir for presiding this session, and also Dr. Himakar sir for chairing this session, and all the participants who have been part of this session, and all the delegates who have joined this. Thank you, and not the least, I thank the Torrent Pharma for sponsoring this session. Thank you, everyone.
Thank you all. Thank you very much. Good night.